I was at a 50th Medicaid celebration in Washington, D.C. And as I was sitting and listening to the guest speakers and the panelists, they were all talking about what Medicaid should look like in the future, where Medicaid should go forward. And what I noticed and observed is that everybody on that panel or presenters were either academics or policy wonks. The voice of people with lived and living experience was missing, people from the community was missing, people from the state and federal government who deploy these programs, to advocates. And their voice wasn't present as they were talking about the future. But then I thought, what if we shook that up a little bit? What if we brought the voice of others who are oftentimes not at the table, who don't have the same power as they do to influence and inform Medicaid policy? So that started IMI, this notion of we're going to center people with lived and living experience, we're going to center community and community voices and give them the power to inform and guide the Medicaid program for the next 50 years instead of the individuals who were at this 50th anniversary, which were policy wonks and academics.
It is important that we continue to add the qualitative data to support what we see in research and the quantitative data using a storytelling methodology that is proven to be impactful when talking to those with lived and living experience. It's important to use the homophily that is available to kind of weave in a braided collaboration between community members and organizations like IMI so that we can continue to get the message out further than an email or a piece of snail mail, but lived experience and the voices of folks who really use Medicaid to live.
I think the value that IMI brings to Medicaid health plans is the neutral nature of the work that they do. They take in the data, they analyze the data, and they provide back, again, neutral, nonpartisan feedback on the impact that we're having for the Medicaid program and for the lives that they serve, that we serve, I should say. And I think that's important to ensure that we are, as stewards of government dollars and as purveyors of support and care for those who need this coverage to be healthier and have healthier lives, that we are doing it based on data and evidence and are doing what's most efficient and effective, not only, again, for the members, which is the most important thing, but also for the stakeholders, the policymakers that are the ones bestowing this opportunity on us.
Being a part of IMI has influenced me in ways, in great ways, specifically as listening to the voice of the community and letting them be heard. IMI helps, brought dignity to Medicaid recipients, so we're not just somebody who's on it and we should be ashamed, but they allow us the dignity and they respect us. And so with them listening to the voice of the community, and that also not just listening, but putting them on the advisory boards and the governing board means a lot because they're opening up rooms that we never would have been in if not for IMI. We always want the community input in whatever we do because the community matters. And so it's my goal to make them feel comfortable, respected, and heard.
Organizations like IMI are really important in this country at this time because there's such misconceptions about who the Medicaid population is. I think that the work that IMI does in disseminating the information that is evidence-based and that it brings the voices of the Medicaid population alongside the providers, alongside the managed care organizations and policymakers and public health experts. Those partnerships are the ones that really help address the disparities that are so severe in this country, and that and it also addresses the value that it brings value to the organizations in healthcare, but also to the people that they serve. And so I am a great believer that the social and economic security of this country depends on how we partner with the next generation to stay healthy and to thrive. And that is what IMI does every day. And so it is relevant today, and it will continue to be the premier organization that really addresses the health and well-being of our nation.
When I think about IMI over the last 10 years, I'm extremely proud that we have held close our values. In fact, we have prioritized equity in all we do. Despite changes and different views, that is still our centering point around how we do our work. It is done in a very inclusive way, in that we are thinking about all audiences. We are prioritizing the voices of people with lived experience. We are gathering objective information to help educate, convene, and spur people to action. And those building blocks have remained with us throughout our work.
IMI has been so important in advancing equity and innovation, and I'll tell you how. They create opportunity at IMI, opportunity for providers, plans, patients to get together and have the conversations that let us know what's really happening to our families, our children. Let us know what the problems are, what we can do about it. Become colleagues, become partners. IMI creates opportunity. Opportunity to have the conversations we need to have.
So what it means to me is being able to be a voice for the voiceless. I always like to think about some of the things that IMI is doing is like educating the community, putting information and, data out that's not just about numbers, but also about helping individuals and what they really need. So just being able to be heard, getting that information out there, being that voice for the people that may not know, as a person that has used Medicaid before, it was a lot of things that I didn't know and didn't understand, and I'm glad to see that IMI is taking the opportunity to really get the information out there that needs to be out there.
As a pediatrician, I greatly value the work that IMI is doing in calling the importance of attention to the needs of families and children. The Medicaid program covers close to 50% of children in the United States, and I believe 60% of births. The criticality of the Medicaid program for our future as a nation to have the healthy children, healthy youth is of critical importance and has been an incredible important part in my career as a pediatrician. And now as I'm leading an organization that specializes in the needs of children with special needs, autism, and disability.
I'm so excited about the future for us. The work we have done over the past decade has been remarkable. It has set the stage for us to be growing and scaling our efforts at a time where other not-for-profit groups are having to scale back. This work will grow and continue because of the leadership we have in our executive director. It will grow and scale because of the community we have built. And certainly it will grow and scale with the leadership of our board.